Everyone wants to improve the care experience, support providers to function top of license, increase capacity and effectiveness, and improve quality and reduce adverse outcomes. What Careteam does is it comes in and, like Intel inside, the chip that makes and connects everyone to do a better job, enables that to happen. I'll walk you through a quick overview. I'm excited to be here. Thank you for the opportunity. So I'm a physician, family doctor, I'm a former emergency room physician. This is my 5th company. And in the last 20 years that I've been involved in healthcare, I've seen the complexity of everything just skyrocket. So we're building Careteam to be the kind of technology that health innovators need to deliver the kind of ideas that they have about improving the world. And I can tell you more about what we've done so far on the journey. But the starting point is always why. Is there are 100 million families across the US who are affected by complex chronic health issues with aging, kids, cancer, mental health, and many of them have many of these conditions at the same time. And there are people who are burning out trying to make this work that need technology in order to be able to take their top of line expertise and with empathy, pan out the best possible care pathway. And that's what we want to enable. And that allows us to create a smile in life's most challenging moments, in moments where families think everything is going to be completely different, overwhelming. Clinicians can step in and be of help. Where we are on that journey is we've actually helped 10,000 patients. And let me tell you more about how. All of these dots represent hospitals across the US. They are organizations in which there are many different departments handling these complex chronic diseases in partnership with community organizations and clinicians that are not inside the hospital. And we call that a health system, when in fact it's not a system. It's a collection of organizations that have each digitized, but they're not connected. And so what happens is we see a huge and growing gap between what should happen and what actually happens for most patients. And clinicians are saying, we are happy to share our expertise and we would love to collaborate, but how? And then on the other side, you have patients who are saying, we're ready to be proactive, but what should we do when? And with Google being able to give you all kinds of information, people are more and more confused. So what's missing is that ability to educate what is the right action at the right time that is completely different in every location. The way we treat diabetes, kidney disease, heart failure, cancer is dependent on the city and the resources and the way healthcare is structured. And there's no digital tool to enable to do that. And so if we go back to those dots, everyone wants to improve the care experience, support providers to function top of license, increase capacity and effectiveness, and improve quality and reduce adverse outcomes. What Careteam does is it comes in and, like Intel inside, the chip that makes and connects everyone to do a better job, enables that to happen. And it's not just theoretical. Let me walk you through a typical scenario for one of our customers. An eating disorder program was treating patients. We helped them go digital within their practice of 500 patients, and they could go live and see patients within an hour. They were able to then invite, through the patient, the ability to bring in the family members and others in the community to execute the plan that the specialty team had put together. And within the next month, they were able to get rid of the entire wait list and put all 3,000 patients onto the platform and start connecting to the family doctors in the community, allied health, pharmacists, social workers, counselors, and other organizations involved so that everyone could be on the same page. And this creates an active network bottom up, something that people have tried to do for the longest time top down. In order to accomplish that, we needed to create a solution that we did over the last 4 years that meets the needs of decision makers, and that quadruple aim we talked about just a few minutes ago, meets the needs for the IT and privacy committees. And we've gone through full approval of privacy impact assessment at large organizations, but also meets the needs of the clinicians, that they're too busy to understand how a new system works. And so they need to be able to get started within an hour and actually do their job better. And also of patients and families who don't want to learn new tools. If you know how to use the internet, you can use Careteam. If you know how to design a clinical program and a care pathway, you can put that and make it digital and start using that to see results in less than a month. So the software is built, it's responsive design available on any device. It allows clinicians to share their plan. patients and others to connect. Everyone needs to be involved using role-based access. But the most powerful behind the scenes element is data. You can start understanding who's making good progress, who needs additional help, and start doing predictions. All of the components behind the scenes are multilingual as well, Microsoft Azure based, and these are the elements that the IT teams need to see in place in order for this to work. But the fundamental of Careteam is we make the complicated simple so that the end user experiences our unique triple superpowers. It's a platform that's designed to collaborate within the same setting and across different settings and meets the HIPAA requirement without having to sign a BAA between organizations. It's meant to be adopted by real humans who have very different needs on education levels and technical abilities. And it's meant to provide data real time so that we can learn and optimize what works and what needs to happen next. The team behind that doesn't include just myself, but also 2 co-founders who are very experienced in the health tech space and 3 executives who brought on board who are helping us scale this business, and a number of advisors and accelerator programs that have taken this big idea and helped us make it a reality. It's not just a good idea for patients and clinicians and organizations, but it represents a good opportunity for us business-wise. If you think about any one of those complex diseases and start adding them up, the estimate is the top 20 of these conditions cost $4.1 trillion around the US. And we can argue about how you slice that market, but we are sitting on a big opportunity. So our ask today is customers, we're ready to go and help people recover post-COVID and deal with massive shortages of clinicians and long wait lists, and also funding. We are on the way with our Series A and need to complete that in the next month to be able to help as many patients as possible, because there is a huge and growing gap between what should happen and what happens, and Careteam can solve that. Thank you.
Question from an attendee: why is there no need for a BAA?
The way we've structured our software allows anyone to share with anyone else within the patient's permission, or the patient to delegate someone to do that. The patient can do it themselves. And because all of that is well documented, it meets the requirements of data sharing without having to have an official agreement between the organization, because we have full patient consent and it's documented.
Since you have such a strong capability with your platform, can you walk us through a use case, an actual example of Careteam in action, how it would work practically?
Yeah. Well, this can be helpful at any stage. The places where I find that the most interesting is there are a number of patients who could benefit from new treatments that are simply not identified. And so the eating disorder case that I talked about earlier is so many patients don't even know where to start. They're afraid of bringing that up with their primary care provider. They're not sure if they have it. And so an organization can literally put up a link to a Careteam and a self-guided self-assessment tool. If at the end of the patient qualifies to be seen by the specialty team, they can actually be seen by the specialty team and then taken and given instructions of what to do until their first appointment. And so you can walk people at every step of the disease through the right actions to take so that they're not overwhelmed. Our geriatrics condition, they had an initial to-do list of 112 items that scared most families and patients. But if you actually break it down into 6 segments, the success completion rate of each one of those segments went up. And by the time they could see a geriatrician, the geriatrician could spend the top of their license capability of answering questions and directing the care. And then that plan got distributed across a network of 39 community organizations that are making that happen, with home visits and Meals on Wheels and dementia coaching and other activities, all under the guidance of the specialists at the acute care hospital.